Hello, Nejmu. Many congratulations on passing this MRCOG exam. And I,
Thank you, ma'am. Thank you so
you
much.
must, yeah, you must be feeling very happy.
Yes, ma'am, I'm happy and relieved actually.
Yes, of course. That is, it's a big relief because you're done with this exam. And can you share your journey, MRCOG journey with us, how you prepared for the part three, and some special tips and guidance for the upcoming candidates?
Yeah, ma'am, I'll share my journey. Ma'am, as you said that this is not a easy exam. This is very tough. And to make it worse, most of us will be giving this exam like continuing working and juggling with the family.
Yes.
All these have to go hand in hand. So literally in 24 hours, you have left with very few time to prepare. That is the biggest challenge anybody is going to face. So if somebody can take off from their work and then they can prepare, it's well and good. You have less of tension, stress, and probably you can do in a very good way. I had uh, I couldn't do it with my first attempt, and my score was 51. Then second attempt it was 59, and this is my third attempt actually.
Yes.
Uh, yeah, this time I could score 81.
Very
But
nice. 81 is very good
yeah,
for you. Yeah. But yes,
thank you,
it
ma'am.
has been a long journey for you. Uh,
Yeah, exactly, ma'am.
so what,
The
uh,
most important
mhm,
drawback I felt in my case was the lack of time. The more time you invest on this thing, I mean,
mhm.
you can success is more easy to. I mean, not easy. It's more reliable to get. So that is one thing I felt from all this experience. But like you never fail, you learn from your experiences. So it was
Yes.
okay for me.
Right,
Yeah,
because even the result shows what they write that you have not reached the expected standard. They don't write
yeah,
fail and pass. And for the pass candidate,
yeah.
they will mention you have reached the expected standard.
Expected standard.
Yes. So during your preparation, like there is a that they have some expectations from the candidates. Like
Mm-hmm.
yes, that is why the result is always like that. So what differently you did this time? Like you said, this was your third attempt. So like what was the changes you made in your preparation, in your strategy?
Yes, ma'am. Actually, first exam, I think looking back, I think I didn't even take it very seriously. I thought that I can crack it, so I took it very lightly. That
Yes.
was the biggest mistake. I did it in my first attempt. So if I would have been serious enough,
Mm-hmm.
things would have been different.
Yeah.
So a second exam, actually, I was expecting that I would have cleared, but it somehow didn't work. So
Right.
for the third attempt, I actually initially I was a bit depressed. I thought that I'm not doing it again. Then somehow I pushed myself and started reading again. So the initial thing was to cleanse myself from all the negative thoughts
Yes.
and set clear targets and
Mm-hmm.
just to recall that Almighty have given so much of past successes. So I don't have to be depressed at all.
Right.
So that was my
Mm-hmm.
starting point for the this preparation.
Mm-hmm.
Then this time, what I did was like one thing I understood that, ma'am, they are giving the domain-based feedback. Like you didn't reach the expected standard.
Yes.
So to understand this exam, it is important that what are the things which will come under patient safety, what are things that will be counted as communication with colleagues, because ACK is something which you can read and you can get. Only thing is that we need to put in more layman terms so that the role player will understand. So ACK will be sold in that way, but the
Mm-hmm.
patient safety, communication with colleagues, information gathering, all should be very planned so that we will have the time management and we will have the right information and we can uh, we can do in a better way.
Yes.
So the thing was that I always had problem with the time management. So I tried doing. I didn't have a consistent regular study partner. So
Mm-hmm.
because my study partner, I always we had the problem with the time zone, time problem. So the
Yes.
time when she was free, I wasn't, and when I was free, she couldn't make it up. So there was some time problem, but um, if you have a very good, reliable, regular study partner, that is too good. But even if you don't feel that you are alone. Like you can do it alone also. But this time, what I did was
Yes.
I took the 2 minutes reading time, and I would try
Mm-hmm.
to figure out like how I'm going to present. I don't. I tried to use that 2 minutes time,
Yes.
and that made a lot of difference.
Right. So, yeah, that 2 minutes is very important. Like you have to
Yeah,
the whole
that's
scenario
yes, ma'am.
and the domains which you will be tested and what will be your task in 10 minutes.
Yeah,
That is important. And yes, you have to organize your thoughts.
exactly, ma'am. So that we don't have to, like sometimes it happens like we don't know what to ask next. So
Mm-hmm.
we will be thinking and we will be starting asking some stupid questions which is not
Mm-hmm.
relevant to the scenario.
Yeah,
So this can be avoided if we have the correct 2 minute preparation.
exactly.
And then,
Yeah, like for
yeah,
just a
ma'am.
simple example, like molar pregnancy case came. So we know molar pregnancy. Now you have to
Yeah.
explain the diagnosis. So it's going to be a breaking bad news. So we will
Yeah.
write
So
BPM
yeah,
in
we don't
short
have to
form.
ask anything about the
Yeah.
ectopic or
Yes.
anything.
Yes.
Don't waste time
Already a
on that.
diagnosed case. Yeah.
Yeah,
So it,
exactly. So to
Mhm.
read the scenario and to prepare how you are going to do this station, that will give you a lot of confidence the moment you enter the station.
Mhm. Mhm.
And I used to do stations alone also. That
Yes.
won't be as good as you do with your role player because there is no other person to interrupt your presentation. You will be monotonously speaking.
Yes.
But this time, what I did was instead of keeping 10 minutes, I used to present with 8 minutes
Yes.
time bound.
Yeah.
So this way, I could have good grip on the time management.
Yes, because in the exam, 2 minutes, the role players speak. They go on and on for, I know, 1.5 to 2 minutes. So out of 10
Mm-hmm.
minutes, yes, Najmo, you're very right. 8 minutes is for the candidate. Rest of the 10
Mm-hmm.
minutes is for the role player, or even in teaching stations, your junior colleague can ask you a lot of questions. So
Mm-hmm.
yeah, that is a good thing.
So I've once you have the time management, then you have the confidence. Then my next step was to explore where I'm going wrong. Like what is the patient safety point in this particular station? Like if the patient is blood group B negative or negative group, you should
Mhm.
say anti-D. Or if the patient is like some subtle points we might miss, which might be counted in
Patient
patient
safety.
safety, like
Very
yeah,
right.
patient, she's smoker and you cannot prescribe now OC pills. That
Very
has to
right.
come.
Mm-hmm.
Yeah, so these are the points which I sometimes we may miss
Yes.
because
Yes.
of like you are loaded with lot of information, but you just need to tell the right information. That's all they want to know with this whole
Exactly.
scenario.
Mm-hmm. Yes.
So
When
even
you're
if we speak the whole
Hmm.
stuff and we don't speak this point, we may not clear the station.
Yes, yes. And you secured 81% this time. So it means that you were very thorough with your stations. Of course, we don't know what will be there in the exam, but
Yeah.
at least what the candidates told me that many were recalls. The topics, they knew the topics, but they were like some twisted recalls. So
Yes,
you
ma'am.
have to follow the role plays agenda at that time. Like you should not have that fixed idea in your mind that I know this scenario. No, like of course you know the topic, but at the same time you have to follow the
Yeah,
role basically.
they don't. I don't know whether they have been given the instruction like not to open up until we ask some specific questions.
Mm-hmm.
There was a station where patient wants cesarean, and we need to counsel her regarding the delivery.
Right.
In that scenario, we don't know why the patient is requesting cesarean.
Yeah.
Unless until we take the full history,
History.
and
Hmm.
yeah, until I
And
asked her
then,
like, yeah, what is
yes,
your thought regarding the delivery plan? She
yes.
didn't open up and she didn't tell me about the Crohn's.
Right. So medical history is very, very important in all these
Yeah,
scenarios, isn't it?
yeah, I asked
Hmm.
ma'am, in that medical history also, do you have
Okay.
any other medical problem for
Okay.
which you are seeing GP? She
Yes, yes.
said that no, I'm not following up for any medical problem. This was the answer she told. Then,
Right.
when I asked her, like, what is your idea? I want cesarean. Then I asked her, may I know the reason why you are
Yes.
opting for
Very good.
cesarean?
Mm-hmm.
Then only she told me this point that, yeah, I had a surgery long back, but
Mm-hmm.
I'm not following up after that. I don't have any problem now. So that was the reason why she was giving me a negative medical history. At the same time,
Right.
she had a solid reason to choose this option.
Yes, yes, yes. Exactly. Because if she is choosing for, like, if she is refusing or choosing cesarean birth, yes, we should know the reason that what is your concern
Huh.
behind that? Why do you want to have cesarean? Or if she's afraid of cesarean, we can ask why are you so much afraid of cesarean? Yes,
Mm-hmm.
that concern is very, very important. And
And a lot of simple points like
mhm,
communication with colleagues, like I will write back to GP if it was a letter from a GP, or I'll write back to the midwife if it was a letter from midwife. This need to
exactly.
be covered. This simple sentence will put a tick in that box, so that communication with colleague will be covered.
Yes,
So this whole exam is
yes.
knowing the station, but you should know what to speak in the station.
Mhm.
That was thing which I was lacking in previous preparation, I think, ma'am.
Yes, yes. Yeah,
And
yeah. And this MDT, I mean, this communication with colleagues, an easy domain to pass. And what we
yeah,
say that this MDT is patient safety also, because high risk cases you can't manage alone. So you have to involve your consultant, the baby
mm-hmm,
pain doctor. If she's a diabetic, then you have to involve,
mm-hmm,
yes, specialist in the diabetes, nutritionist and all, and in some cases even the counselors. So and giving her the support group numbers, contact numbers, these are also important. And talking about the
yeah, yes, ma'am.
signs, so
Yeah.
important patient safety points. And how about the recalls, Nijmu? You you must have covered the recalls as well. Um,
Yes, ma'am. And recalls were like most of the stations will be like recalls, but with a twist. As you
mm,
said that sometimes, for example, nothing specifically I'm telling, ma'am, but it
mhm,
will be like a PMS station where we will be chanting all the treatment options like OC pills, blah 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 blah.
mhm.
But if we have missed asking her BMI, like what is your weight to height ratio, and
Yes,
it turns out to be 35, then you are telling that OC pills as an option for her.
yes, yes,
Or the patient would like to have or seeking planning for pregnancy, and then we are giving her the option of OC pills. I think you have this clearly mentioned in your station.
mhm,
Like we should not be telling her that you can go and take OC pills because because of the PMS symptoms. We need to know their
right.
um,
Even
yeah,
medical
their
history is important in
yeah,
PCs.
medical history is important.
Like
Yes, ma'am.
migraine with
Smoking
aura.
person, yeah,
Yes.
smoking, migraine,
Mm,
and then we are advising them to take OC pills. This, if you see that, yes, I have spoken everything about PMS. I have spoken about all the options. I could finish on time, but the problem is that we would have failed in the patient safety point because you are prescribing OC pills to a person who is smoking or a migraine with aura
right.
or BMI 35.
Mm,
So
mm,
that will go against the patient safety. So even if we finish the station, This was the mistake I was doing, I think, ma'am. Like
Mhm.
I'm not realizing that what it's like putting your knowledge and working out with the clues that role player are giving.
Right. Yes, yes. And like there are candidates who texted me like it was their second attempt also they couldn't pass. So what is your message for them? Some of them are really very, very disheartened. So what would you like to say, Najmu? Because I know it has been a long journey for you as well.
Yes, ma'am. I would say that um, see, there are a lot of things like there are a lot of points that will think you that you are not good for MRCOG,
Mhm.
and MRCOG is so tough, you can't crack it. And whether like so many things are there, like it's of course this fees is too high, and you are compromising your family, your work is getting compromised, your sleep is getting compromised, your food is getting compromised.
Mhm.
But at the end of the day, never hesitate to attempt, and never give up, because I was also in that state. I used to feel low. I used to think that I
Mhm.
used to doubt myself, like whether
Yes.
I'm not capable in clearing this exam. But this is just an exam. This is not going to define you. But you will fail, definitely fail, if you consider that you are a failure.
Right.
Just think
Yes.
that this is just an exam and there is no harm in me attempting again, because
Mhm.
if I clear, I will get a MRCOG. If I fail, it is just an experience for me.
Yes. Learning
and
experience.
and and honestly, ma'am, I have done PG, but doing MRCOG, it was different. It has
Yeah, it
refined
is
me.
totally different.
I'm spending more time with my patients in the OPD. I'm giving more emphasis on the counseling part, which honestly I was not doing otherwise.
Yes, yes.
I'm
That
sorry to
counseling
say. Yeah,
part is not covered in all the postgraduate exams, but
exactly, ma'am.
the Royal College gives a lot of emphasis on that because they're concerned about the women's health. Of course, being an
Hmm.
OB-GYN doctor, you will be concerned about the women's health, but giving the time, lot of time to the patients. Of course, this MRCOG is going to make you definitely a very good clinician, no doubt, no doubt. And
And yeah, ma'am.
like,
And like
yes, go on.
they have kept some four attempts for passing MRCOG, so they themselves know that this is a tough exam.
Mhm,
So
of
it is
course.
okay to fail. It is not a shame or not a problem that we are failing.
Yes.
And it this exam depends on two things, luck and hard work. So we cannot modify the luck part, and we can only modify the hard work part.
Yes,
So
yes.
just it's hard work and practice, that's all. And
Practicing. Yeah.
those who are feeling low, I just want to tell them that I was one of I used to feel the same
Yes,
way when
Najmu,
I
I
failed.
remember
You know, no,
your
ma'am.
text
Yeah,
when you texted me
yeah.
if after your second attempt, but I always encourage, I try my best to encourage
Yes, ma'am.
candidates because we
Yeah,
have been through that phase. That's
yeah. Yes, ma'am. Some good mentors like you always encourage us, and I would like to tell them that take some don't jump and start again. Take
hmm.
some time to heal yourself.
Yes,
Get rid of all the negativity,
yes.
negative thoughts from your thing. Stop thinking that. Don't even doubt yourself for a second after that. That
Hmm.
healing process is very mandatory. Once you heal
Yes,
completely, just go for it.
right. Like the result just came on 18th June, isn't it? Yes. So
Yes, ma'am.
at least those who are going repeating, those who will be repeating the exam, they can start from 1st July. 2 weeks, 10 days, give yourself time. Yes, like you said. And after that, from 1st July, start with one station, two stations, but please restart and refocus. And gradually you will build up the momentum. So, because we are human beings, we are full of emotions. We are not so rigid, isn't
Yes.
it? We are not machines.
Yes.
So, some are emotionally very weak, some of them are emotionally a bit strong. And if you get a partner, that's really good. Uh,
Too good. Yeah.
that's really good. Anything
But
else,
even if you
Lakshmi?
don't
Yeah.
get partner, don't think that
Like,
you won't be able to do it. Keep
yes,
working on it. As you said that at least do one or two stations. And what I felt was, ma'am, more than reading, if you keep
talking.
doing the stations, the things, yeah, talking, that
Yes.
keeps things in your brain and you won't
Yes.
forget.
Yes.
Vulval station, you know that there is no MDT. You know the
Mm-hmm.
lichen sclerosis, there is no MDT.
Mm-hmm.
GP will be managing this. You keep doing one or two times, then you won't forget only.
Exactly. Yes, yes. And practicing is very, very important because when
Yes.
you practice, the important points will get registered in your mind. So during the exam,
Hmm.
you will be very spontaneous, and at the same time, you have to modify your template in the exam. It should not be
Mm-hmm.
scripted, isn't it? It should be
It shouldn't
natural.
be scripted.
Yeah,
Yeah.
yes, yes.
So if you can modify the template by two ways.
Mm-hmm.
One is that like keep practicing, so you will start putting your own touch to it. Secondly, the 2 minutes preparation that will make a lot of difference. The 2 minutes preparation is
Hmm.
very important.
Very
It
important.
changed a lot of perspective in my case.
Right.
Uh, it helped me to plan properly.
Yeah, yes, yes. So, like, everyone has to be, I think, thorough with the recalls scenarios
Yeah,
because that
because we should
cannot
know
be
because
forgiven. Yes, there
yeah,
will be
exactly.
80% scenarios are covered from recall. Of course, topics will be same, but as we know, there will be some twist. So, and what about the guidelines, recommendations? I mean, revising the guidelines and patient information leaflets. Um,
Ma'am, patient information leaflet is quite easy, which is in a layman term. We can
hmm,
just read and just leave it.
yes.
That will retain in our memory also because
Yes.
it's simple words and
Mhm.
help us in putting like how to explain the diagnosis. All those things will be quite easy.
Exactly.
Guidelines, ma'am, since we have done in MRCG part 2 and all, we already know. There's nothing,
Hmm.
I don't think that I didn't go through any specific guideline. Only the sometimes you get confused with certain point. I used to go back and read. Otherwise, whatever notes I have prepared, I have just gone
Yes.
through that only.
Hmm.
I have not gone through the new guidelines, of course, like hyperemesis, few things which
Yes.
came up new.
And
And the stock articles were like beautiful stories which you can just read it. They're
yes,
too
yes.
good.
Yeah, yeah. Like if when you're feeling very sleepy at night time, or if you're on duty and you're not able to concentrate on anything, just open your mobile or laptop or whatever and just read it like a story, like you said.
Yeah,
And
exactly.
the boxes and flow charts are there on which you have to concentrate little bit.
Yeah.
Because, see, the scenarios are of 10 minutes. So, 4 minutes will be your introduction, aim, agenda, information gathering as well. Then you have to offer examination if required. Management part is
Mm-hmm.
another 4 minutes, isn't it? So, they don't
Mm-hmm.
want you to talk everything which is written in the guideline or in the talk article,
Exactly.
but only the important points which are required in the management. So just the important points. But how to manage that thing, it comes only with practice. And there is no shortcut, no shortcut.
Yeah, there's
Yes,
no shortcut now.
yes. Any precious tip, Najmu, before we end the meeting? Anything else you want to say?
That's all, ma'am. Just don't think that it's nothing. Means once you clear all your like sleepless nights, all your problems,
Hmm.
everything will vanish. So it's all about reaching this point. So
Yeah,
don't
yes,
be hard on yourself. Just do it. You can, anybody can do it. If so many
yes.
people have done it and we are no different, so
Hmm.
we can do it. So
Yes,
don't worry. And just think that if you're feeling low, just think that those who have cleared also felt the same way at some point of time. So
yeah,
this
yeah.
is not only with me. So
Yes. There,
just
there are
work hard.
there are few people who cleared in the first attempt. Many cleared in the second, many in third attempt. So Yes, and that dedication has to be there. And once you book the exam, then there is no looking back. That is what I say, because booking the exam is also like a competition in itself.
It's not less than a gambling nowadays.
Yes, yes.
Booking
The
exam.
the message will come sold out. I mean, all the seats sold out. So
Even,
like it
even
is
this
a
thing,
fraction of
even I
seconds.
was trying, exactly,
Hmm.
ma'am. We were trying to book, the site crashed, and like it
Hmm.
was buffering, and nothing was happening. No page was coming.
Hmm.
Then at 21st second, 21st minute after we
Yeah.
entered the site, I just got booking. I
Right.
thought like,
Hmm.
okay, this time I may not get a seat this time, but
Hmm.
things do change. So don't
Yes.
give up in the till the last minute.
Yeah. And how did you revise? Just a revision tips for the candidates.
Yeah, revision is very important. Just because we have done all the modules
Mhm.
doesn't make us like we can't remember everything. So we are not robots, we are humans. So we tend to forget. So
Mhm.
nobody can remember everything, and we are not going to revise everything the day before exam. So it is a practice that is going to help us. So if we could revise one or two times, then it is too good. And your audios and all were too good, ma'am. Like it was crisp and it contained all the points. So even if you're driving, we can just keep listening to these audios,
Mhm.
which will help in revising things. So
Yeah.
revision is not like, yeah, and then towards 1 month before exam, we should have finished all the modules
Mhm.
and we should start revising. And
Amazing.
taking mock exam will be good, even if you're practicing with your regular study partner. Then 1 month towards exam, start doing like 7 stations in a row, and like 14 stations in a row, so that you will have the stamina. That is very important, because we get tired after doing 6 7 stations if we haven't practiced. If we keep on practicing, 14 stations won't look so such a Herculean task. So that is also important, like doing one station each. More than that, do one person can do 7 stations in a stretch, the other person can do 7 stations in a
Mhm.
stretch. That will help in building stamina. That helped me a lot.
Right. Yes, yes. So revision is I mean, fast revision. It needs really
Yeah,
very
fast
fast revision
revision.
in the
It's
end.
not like
Yeah.
sitting with the same topic
Mhm. Yes.
for 1 hour. It's not like that. Just
Yes.
quick revision.
Yes, yes, and yes, and better to like we can also take one set of recalls with 14 different
Yeah,
modules and
yeah.
practice that. Practice that. Right. Okay. Thank you, Nejmu, for giving your precious time and precious tips. And I'm really elated. I'm really glad that you did it this time. And you are MRCOG now and a proud member of the Royal College. So God
Thank you,
bless
ma'am.
you, my dear. Stay blessed always. Keep shining and keep smiling, my dear. Okay.
Thank you,
Thank
ma'am.
you. Thank you.
Alhamdulillah. Thank you, ma'am.
Alhamdulillah.
Assalamu
Thank
alaikum.